Joining me right now is the president of the AFL-CIO, Richard Trumka. Richard, thanks very much for joining me this morning. What's your reaction to this bill?
Well, first of all, it was much needed. And like every bill, it's not perfect, but it's going to do a lot of good, and we need to have it done very, very quickly. There are some things not in the bill that are very important that will have to be included very quickly. It doesn't do enough with health and safety of our frontline workers. It does nothing to protect U.S. pensions. One man and one man alone, Maria, stopped that from happening. The president agreed. Nancy Pelosi agreed. Chuck Schumer agreed that pensions should be included in this bill, but Mitch McConnell said no, so it's not in there. There's also nothing in there for the Postal Service and some other things. So while it's going to do a lot of good and it's going to help a lot of people, we need to make sure that those on the edge that weren't covered by the first bill get covered very quickly.
Richard, were you consulted on this? I know you have a rapport with Nancy Pelosi and many in the party. Did they ask you what you think is most important beforehand?
Yeah, we were in constant contact on this bill. The first bill that came down was actually a terrible bill. It had no controls for the money, so they would have just been sent out to people, to corporations with no control over them. So more controls were put on the money that's going to be given out, and we added stuff to help working people. We added things into unemployment insurance. We added things into state and local government, hospitals, the help for hospitals. All of those things were added in the bill to make it much better. Still, as I said, not perfect.
Well, I know that there was also a lot of conversation of adding things that had nothing to do with COVID-19, like abortion funding, like tax credits for solar panels, things like that. That also was obviously just a conversation. It never made it in.
No, those were, I think there was a lot more chatter on the outside rather than on the inside. Those things weren't seriously advanced along the way. We talked about having an emergency temporary standard, and that didn't make it in there. And that means frontline workers, Maria, are still going to be exposed in a way they shouldn't be exposed. So we have to continue fighting.
So let me ask you about that. Because the National Nurses Union is the country's largest union obviously for registered nurses. It's an affiliated union of the AFL-CIO. What are you hearing from the nurses during this crisis? We want to make sure that our healthcare workers are protected.
They're saying that they don't have the proper training and the proper equipment to get things done. Not the training so much, but the equipment, that they're short on equipment. Some nurses had to make their own masks, cut up gowns and make masks. That's totally unacceptable. So we need the president to use his War Power Acts to help with manufacturing, to get all of those respirators out, not disposable ones so much, but reusable ones, so that we can protect our frontline workers. And then you have people at the VA that don't have proper PPE. You have people at the airlines, for instance, the flight crews. You also have the security people that are being exposed and don't have proper training or proper equipment that'll make this pandemic even worse.
Unbelievable. Richard, what do you think this does for work longer term? Do you want to see certain shifts or changes in terms of priorities for workers now that we know that work can be done from home in a number of industries? What's your take longer term?
Well, I think, first of all, you have to look at the safety net longer term and the broadening of UI, unemployment insurance. Hopefully, if it sticks around and stays in its present form, will be good because it covers more people that weren't covered before. Different types of work, we've known this, and we've tried different types of work. Some work can't be done. I mean, a hospital worker can't do their work from home. They have to be there. A letter carrier can't do their work from home. But you'll see new channels developing because of this, I'm sure, in the future. Some for the good and, quite frankly, some for the bad.
So we're waiting on jobless claims this morning, Richard. There are estimates out there that jobless claims could go as high as 4 million, which of course would be a huge spike from what we saw just last week at 281,000. What are you expecting in terms of jobless benefits? Do you expect that most people will have already applied for jobless benefits, given that they've been home now for over a week, at least?
Some have. Some haven't, because some were just furloughed. They weren't really laid off. Some didn't qualify under state plans. So the new plan, the new stimulus plan, broadened out who's eligible, and we'll be able to get money into their hands far, far more quickly, which is a good thing. We're going to see a lot of layoffs. And this one, Maria, unlike in the past recessions or past downturns, we've seen manufacturing and construction go down first, and then low-wage workers go down second. This has been reversed. All low-wage workers got hit immediately with this. That's why the sick days were so important, so that they would have a stability and some funds to keep them going. The bill, unfortunately, doesn't include sick days in it, but it's going to allow us. They're going to get unemployment now, so we'll see a lot of that. The claims are going to be high, because the bottom of this was not a gradual drop. This was a major drop.
Of course. Yeah, sure. And they were told to close businesses and go home. That's the bottom line. Richard, it's good to have your insight this morning. Thank you, sir.